Vascular surgeons employ a range of sophisticated techniques tailored to the unique circumstances of each patient's arterial blockage. The first procedure we are going to discuss is angioplasty. Prior to the procedure, the patient may receive a local anesthetic or sedative to minimize discomfort. The surgeon inserts a thin, flexible catheter into an artery, usually in the groin area, and carefully navigates it to the site of the blockage. Contrast dye is injected through the catheter to help visualize the blocked artery on a monitor. Once the exact location of the blockage is identified, a smaller catheter with a deflated balloon at its tip is advanced to the site. The balloon is then inflated, exerting pressure against the plaque buildup and expanding the narrowed artery to restore proper blood flow. In some cases, a stent, a tiny expandable mesh tube, is placed at the site of the blockage to help prop the artery open and prevent it from collapsing again. Another procedure vascular surgeons perform is atherectomy. Atherectomy is similar to angioplasty in that a catheter is guided to the site of the blockage using fluoroscopic imaging. However, instead of using a balloon to widen the artery, the surgeon employs specialized cutting devices or lasers mounted on the catheter to remove the plaque buildup directly from the artery walls. This precise removal of plaque helps to restore the natural diameter of the artery, promoting improved blood flow. Bypass surgery, also known as revascularization, is typically performed under general anesthesia. The surgeon makes an incision in the skin over the blocked artery and identifies a healthy blood vessel, often from the patient's leg or arm, to serve as the bypass graft. Using meticulous surgical techniques, the surgeon creates a detour around the blocked portion of the artery by attaching one end of the graft to the artery above the blockage and the other end below it. By creating this new pathway, blood is able to flow freely, bypassing the obstructed segment of the artery and reaching the tissues and organs beyond the blockage. In cases where the blockage is caused by a blood clot or thrombus, the surgeon may opt to perform a thrombectomy to promptly restore blood flow. Using specialized catheters and devices, the surgeon carefully navigates to the site of the clot within the artery. Various techniques may be employed to remove the clot, such as suction devices, thrombus aspiration catheters, or mechanical thrombectomy devices. Once the clot is successfully removed, blood flow is restored to the affected area, alleviating symptoms and reducing the risk of further complications. These interventions exemplify the diverse arsenal of tools and techniques available to vascular surgeons in their mission to restore optimal blood flow and improve the overall health and well-being of their patients. The selection of a particular approach is guided by a thorough assessment of the individual patient's condition, including the location and severity of the blockage, as well as their overall health status and medical history. Give us a call today at 480-668-5000.